Over now to Nyeri, right?
Exactly. We want to take you to Nyeri, where Nyeri County has been struggling with a huge wage bill, yet it is grappling with poor staffing in areas such as health.
A new public service board is set to be sworn in this morning, and Martin Munene is there, is joining us live from Nyeri. Martin, good morning. What difference will this board make?
All right, a very good morning to you, Trevor and Zinzi. And this morning, the swearing in has actually happened. These board members are expected to serve Nyeri County for about 6 years. And in Nyeri County, like across other counties, and indeed even the national government, there has been a problem of a huge wage bill, too many civil servants, and yet there are some areas that actually do not have enough members of staff. And therefore, that is actually one of the things that this county public service board is expected to address. And I want to speak to Governor Mutahi Kahiga here to just give us an idea of what they hope this board will achieve and what the situation is like for his government. A very good morning to you, sir. This morning you've sworn the County Public Service Board. We understand Nyeri County is at about 45% in terms of the wage bill. We need to bring that down. Maybe what will this board do to ensure that happens and also address the challenges of a few staff, especially in the health department?
Thank you very much, Martin. This morning we've been able to appoint the chairman, the secretary, and 4 members of the County Public Service Board to serve for the next 6 years. We already had 1 member who has already served her year, so we now are at full capacity. Yes, like you have rightly said, we are grappling with a huge wage bill, considering that Nyeri was a provincial headquarter, and we in fact took over quite a huge workload, workforce. The board that has just exited had just completed a staffing plan, and from that staffing plan we also had a program called the VER, that is the voluntary early retirement, and we have set aside about 100 million Kenya shillings for this financial year, in which we are going to ask our members, our staff, those that may feel they want to voluntarily get an early retirement, to do so, with the promise that they will not lose any of their benefits, and also they will get a golden handshake. All these are matters that are a work in progress, and we expect that this public service board, which I have appointed today, and which is also vibrant, in that we have tried to mix both those with experience and the very energetic ones, will be able to take up this matter and run with it. They will be able to execute it fully, and as they do that, we urge them to wear a human face, because you will be dealing with human beings, you will be dealing with families, you will be dealing with the people, and the people have emotions. Every decision we make must have an implication that we think about, so we are not going to be rash. And my opinion is that this board has the capacity and the willingness to achieve that. So they can count on my support and the support of my executive to ensure that everything goes on as expected. Further to that, we also commit to assist them achieve every of their objectives, because we know there are places where life has been made very difficult for county public service boards. I have worked with the previous board for 2 years. There has never been a complaint. We have ensured they have their autonomy. Of course, we consult, but more so, we do not want them to feel like they are an overextended arm of the executive. We would also want them to do their own, to bear with them their own autonomy and make decisions that they'll be held responsible for.
All right. In the health department, even yesterday we saw the medical practitioners union actually say that there's a huge shortage. Yes. Is there plans to ensure that you hire people as we finish?
Yes, Nyeri County has continued to put in a lot of money in the health department. Currently, the current supplementary budget, we have raised our budget for health to 2.85 billion. And yes, we are grappling with a shortage of nurses, for which we are going to hire 60. We have clinical officers. We are going to increase a number. We already have some consultants, and we have put out adverts, I think, for about 5 or 6 of them. So yes, we are ready. We continue on a daily basis to replace those that exit service. Right. But as a rapid resort initiative, we are hiring 60, and that is the first thing we expect the board to take over. Yes.
Thank you very much. The governor there saying that the work of this particular board is actually cut out. They're supposed to actually hire, for example, 60 nurses amidst balancing or a delicate balancing act of ensuring that they actually maintain the level that is required by the law in terms of spending when it comes to staff. And at the same time, the governor has here said they have a plan to actually just ask members who are in the public service who can actually volunteer to step away to actually do that. It's an interesting perspective, and it's something that, of course, you're going to be following in the coming days to just see even how the public service itself, or the members of the public service in Nyeri County, will be receiving this particular move by the county government of Nyeri. From Nyeri County, I bring it back to in studio. I'm Martin Munene.